So basically, congenital heart defects are mechanical problems in different parts of the heart, which involves the partitions of the heart, which involves the valves. And the worst thing about these defects is that there could be combination. You can have hole in the heart, narrowing of the valve, leakage in the valve. Sometimes the arteries go the wrong way. So if the impure blood, rather than going into the lungs, goes back into the body, and the pure blood going into the body goes back into the lungs. So these are far more complex problems than the heart defects that you see in adults, what we call as coronary artery disease. So this is what forms the main difference between these two subsets. So I think that sometimes if the defects are very mild, then the patient may be completely asymptomatic, and you may realize that he has a problem as an incidental finding, either on X-ray chest or when he is being auscultated by a pediatrician for an unrelated cause. But most of the patients who are symptomatic will present with either shortness of breath, easy fatigability, repeated respiratory tract infections, failure to thrive, history of pneumonias, or some of the babies may present with bluish discoloration, what is in medical parlance called as cyanosis. Very rarely patients may present with stroke, or patients may present with palpitations or unconsciousness, but these are uncommon presentations of congenital heart disease. So basically congenital heart defects can be treated with medicines, but medicines can only take care of some of the symptoms, and that too may help in taking care of the symptoms, maybe 15%, 20%, but not all the way. Because as I said earlier, these problems are mechanical problems and therefore need mechanical solutions, and mechanical solutions are of two types. One is a surgical solution wherein you cut open and go into the heart and then either fix the hole in the heart or repair the valve which is leaking or open up the valve which is narrow. But over last maybe 25 to 30 years, non-surgical treatment, what can be done through transcatheter techniques or mini surgery as you call it, has become very popular because it is very safe, it is very effective, and has far less morbidity, in the sense that you stay in the hospital for 24 to 48 hours. There is no use of heart-lung machine, there is no use of blood products or blood transfusions, you don't have to remain on ventilator. So these are many advantages, and most importantly the pain is much less and there is no scar. So aesthetically these interventions have been shown to be and have been found to be quite effective. And because they are safe and as effective as surgical interventions, I think some of the lesions or some of the defects can be treated very well with these techniques. So you know, congenital heart defects is not one single entity, it's a very wide spectrum. So some of the congenital heart defects are so mild that you may require nothing, and the child will have normal quality of life and longevity. Some of them may require something, but maybe at a stage when the valve becomes really narrow or really becomes leaky, so maybe in the second, third, fourth decade. Whereas some of them will require immediate interventions because they are very complex. And it may not be one intervention, but there may be multiple interventions. So depending upon what kind of congenital heart disease you are looking at, the outcomes will vary. As far as some of the simple defects are concerned, I think now we have enough things in our armamentarium to take care of these children, and their quality of life and longevity is as good as normal kids. Whereas there are some which are very complex, wherein you require multiple surgeries, and even at the end of those multiple surgeries, quality of life may not be as good, and even longevity may be little compromised. But I think in last 3 to 4 decades, we have gone a long way, both surgically as well as with non-surgical techniques, to improve both quality of life and longevity in this subset of patients. Once upon a time, there was almost no treatment, and people used to give up these children. But things have changed in a big way, not only in the Western world, but even in our own country. We have many good, well-trained surgeons, well-trained cardiologists who can take care of these children, not only during their childhood, but even when they grow up and become adults and even elderly. Thank you.